Hello, myself Kalyani Ramteke. In this video, we will learn about the ECG machine. ECG stands for electrocardiograph. ECG machine uses for a diagnostic purpose, that is any heart related problem like myocardial ischemia, breathing difficulties, dyspnea, sinuses rhythm, etc. We will learn about how to handle ECG machine. Now we will learn about how to use ECG machine. मॉनिटरिंग केबल ECG मशीनला अटॅच असतो आणि तो पेशंटला अटॅच असलेल्या क्लॅम्प्स आणि चेस्ट वेवफॉर्म आपल्याला मॉनिटरवर दाखवतो. ECG मशीनला अटॅच 4 क्लॅम्प्स असतात आणि 6 चेस्ट लीड असतात. Now we will learn about placement of individual clamps according to their color coding. Red clamp place on right hand, yellow clamp place on left hand, black clamps place on right leg, and green clamps place on left leg. Chest lead place according to their number as well as color code. Numbering like C1, C2, C3, C4, C5 and C6. C1 is a red color, C2 is a yellow color, C3 is a green color, C4 is a brown color, C5 is a black color and C6 is a purple color. Then how to place we will see about them. First, red lead place on right side of the sternum. Second, yellow C2 the place on left side of the sternum. Then green chest lead placed between C2 leads and C4 leads. Then brown, black and purple means C4, C5, C6 placed on between the 5th and 6th in the mid-clavicular line. After placing of clamps and ECG leads, switch on the ECG machine by the on and off button. Then we are able to see waveform of the patient's rhythm. If no any vibration in ECG monitor, press the start or print button and get a ECG.